Good morning. It's Dr. Scott from Chiropractic Associates in Long Grove, Illinois. Do you or a family member have headaches? Maybe you've been diagnosed with migraine headaches or tension headaches. Sometimes those tension headaches are called cervicogenic headaches. So there was an interesting study done fairly recently regarding cervicogenic headaches. And those are the headaches that start with discomfort in your neck or maybe discomfort in your upper back. These people complain because they go to work and they develop a headache every day when they're working at the computer, or they wake up with a headache with discomfort in their neck and back that then migrates up into their head and creates a headache. Also, cervicogenic headaches are usually just on one side. And there's rarely, if ever, what we call a prodrome. So there isn't like a funny taste in their mouth or spots before their eyes, in contrast to people who have migraines. So these headaches kind of start because there's trauma or postural concerns in the neck, and then they radiate up into the head. So if you have headaches like that, or have a friend or family member that has headaches like that, you'll want to pay attention, because they just did a study where they looked at a number of studies. So they took a group of studies and they compared all of the endeavors, all of the treatments that were associated with treating cervicogenic headaches. And they found some very interesting statistics. Now, number one, they found that cervicogenic headaches seem to affect about 1 to 4% of the population. That's a lot when you think about the millions of people that live in this world. So 1 to 4% suffer from these headaches. And as I described, they often have origins in the neck and upper back and then radiate into the headache area in and around their head. So November of 2022, they did what's called a systematic review of 20 different studies. About 1,500 patients participated in these studies. And of those 20 studies, 8 trials specifically looked at spinal manipulation. So what chiropractors do in the chiropractic office, they looked at spinal manipulation as the primary mode of treatment of these cervicogenic headaches. And they found some interesting things. Number one, they found that spinal manipulation offered statistically significant reduction in short-term headaches. So if you have a headache, you get adjusted, you got relief. But they also found something else, that those people who continued for 6, 8, maybe 10 visits had long-lasting, and we're not talking just a week or two, but we're talking several months, up to maybe a year, relief in their headaches with spinal manipulation. Now, they also studied things like instrument-assisted massage, or Graston. They studied things like kinesiotape. They studied things like massage. They also studied exercise that improves posture. As you can imagine, your posture that you have while working at a computer, or maybe the way you sleep or other things, can have a big impact on cervicogenic headaches. And they found that those things also reduced frequency, intensity, and duration of headaches. So the conclusions are really good if you have headaches. Spinal manipulation with exercise, with other endeavors, is safe, statistically significant as far as reduction of short-term and long-term intensity, frequency, and duration of cervicogenic headaches. So if you were a family member suffering from cervicogenic headaches, you ought to look at the chiropractic office. Instrument-assisted massage, kinesiotape, exercise therapy, posture modification. These are all things that we offer and are fairly consistent in our office as far as headache and neck pain go. So you ought to look at investigating these headaches and the treatment that can be offered for your headaches at the chiropractic office. So my name is Dr. Scott. We're in Long Grove, Illinois, and we'd be happy to be of assistance at our chiropractic office. We hope you're having a good day, and we hope you get relief with those headaches.